Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Zoe Rothblatt, Director of Community Outreach at GHLF, and we're here live reporting from ACR, the American College of Rheumatology Annual Convergence, where patients, providers, and researchers all come together to learn about the latest updates in rheumatology. And today we are interviewing providers and patients, so let's start with our first guest, Sharon Dowell. Sharon, welcome to The Health Advocates. Can you please introduce yourself to our audience?
I am Sharon Dowell, and currently I am the Medical Director of Rheumatology at NEA Baptist Hospital in Jonesboro, Arkansas. And that's coming right after working for over 10 years at Harvard University in Washington, D.C. And I have been a rheumatologist for, over 10 years. Like, time really flies.
So we're at ACR. Which session are you most looking forward to this year?
At ACR, the session that I love the most from the time I was a fellow is a Thieves Market. And that's because you have those really interesting, puzzling presentations that challenge the mind. And it's always a challenge to come to the right diagnosis. And it shows how diverse rheumatology is.
And can you tell us a little bit about how attending an event like ACR helps you become a better health advocate?
Attending an event like ACR, it helps us in many different ways. It doesn't only enrich us in terms of knowledge and updating ourselves on what is happening in the world of rheumatology, but it's also an opportunity for networking, an opportunity to interact with your fellow rheumatologists around the globe and to hear about different challenges that they themselves are facing. And I think that allows you to better advocate for your patients because it gives you all these different nuances of care and the patient experience as well. Some that you may not experience yourself, but it helps you to have that sort of really broad view of patient care.
Well, thank you so much, Dr. Dowell. And now we have another clinician with us, Dr. Swamy Venuturupalli. Dr. Venuturupalli, can you please introduce yourself to our audience?
Yeah, hi, my name is Dr. Swamy Venuturupalli, and I run a practice called Attuned Health in Los Angeles, California. I've been doing clinical trials for over 20 years. I have participated in over 150 clinical trials, several of them as a principal investigator, several of them in lupus, myositis, some in rheumatoid arthritis.
And are there any lupus-specific sessions during ACR that you're looking forward to this year?
Yeah, the big lupus-specific sessions that I'm really interested is in some of the newer therapies for lupus, particularly related to the advent of these drugs called CAR T cells, which are really interesting. They're the new kids on the block, really, and I'm trying to learn more about them so that I can discuss them from a knowledgeable perspective with my patients. So I think those are the sessions I'm really looking forward to. I think there's some posters related to CAR T cell therapies in lupus. I have a patient currently with lupus nephritis, and she's tried multiple medications, and unfortunately they've not been able to control the lupus. So I'm interested in learning more and taking it back to her when I get back to my practice and letting her know what I've learned.
Finally, why is ACR and specifically the lupus research that comes out of it important for the patient community to learn about?
Well, ACR is the biggest show in rheumatology. It's where rheumatology meets. It's called Convergence for a reason. It's for people all over the world coming in, presenting their research. It's the best scientific meeting for anything in rheumatology, lupus included. Lupus is actually highlighted quite a bit in the programs throughout ACR, and it attracts a lot of lupus researchers from all over the world who want to present their data, their research, and what they're doing and what's new and exciting. And it's a great way for people like me to come in, interact with colleagues, and learn from their own experiences.
Well, thank you so much for joining us on The Health Advocates. And listeners, we're not done yet. We've also interviewed patient, dietitian, and Creaky Joints contributor, Cristina Montoya. Hi, Cristina. It's so good to be with you. Can you start by introducing yourself to our audience?
My name is Cristina Montoya. I'm a registered dietitian and a person living with Sjogren's disease and rheumatoid arthritis for more than 20 years. I am excited to be here at ACR for the very first time, and very first time that I had the opportunity to participate in a panel. I was with Eileen Davidson and other team members. We were discussing about the unrecognized symptoms of rheumatic diseases, so that it's not just joint pain. So I was very honored to share my experience as a patient and also as a registered dietitian, as every single rheumatologist gets a question about diet and arthritis.
So, what has been your favorite thing at ACR so far?
My favorite thing at ACR, okay, so the fact that I was a speaker, for the first time attending ACR, being a speaker and sharing my expertise in front of over 200 people, that was pretty amazing. But there's also something else that happened, and it happened last night. So if you don't know, I've been involved with the OMERACT Sjogren's disease working group. That is an international group that are working on basically developing new domain outcomes set for clinical trials so we can actually have more validated data in Sjogren's disease. And I was so happy that my advocacy about the gastrointestinal manifestations in Sjogren's are being taken into account. And I was actually very honored to be one of the patient partners that have been contributing to the development of these tools. That was a highlight for me.
Thank you so much, Cristina, for joining us and all the work you do for patient advocates. Finally, we have our very own Dr. Shilpa Venkatachalam, who is the Chief Patient-Centered Research and Ethical Oversight Officer at GHLF, as well as co-principal investigator of PatientSpot. Shilpa, you've been meeting with a lot of healthcare professionals for the past few days here at ACR, and you've also been to many presentations. Can you please tell us how this year's ACR has been? What you've learned, any highlights you want to share with our audience?
Thank you, Zoe. So attending the American College of Rheumatology conference 2024 right here in DC on a beautiful sunny day was truly inspiring. For many of us living with rheumatic conditions, like myself, this conference is more than just a meeting. It's really a beacon of hope and progress. And this year, I was particularly moved by the numerous patient-centered sessions that emphasize the importance of our voices as patients in shaping research and treatment strategies. Hearing first-hand accounts from fellow patients and seeing our stories highlighted alongside cutting-edge scientific advancements reinforce the crucial partnership between patients and healthcare providers. The 2024 ACR conference showcased some remarkable strides in rheumatology research, reflecting our shared commitment to improving patient outcomes. Breakthroughs in biologic therapies and novel treatment modalities were at the forefront, promising enhanced efficacy and reduced side effects for patients like you and me. Collaborative panels underscored the vital role of patient advocacy in guiding research priorities and ensuring that scientific developments must align with the real-world needs of those affected by these diseases. It was heartening to see such a strong synergy between researchers and the patient community, driving forward innovations that hold the promise of a better quality of life for us all. The American College of Rheumatology 2024 has really reinforced our dedication to advancing rheumatology care through collaboration, innovation, and unwavering support for the patient community. We're truly excited about the future and remain committed to bridging the gap between research and real-life impact, ensuring that every breakthrough translates into meaningful improvements for those we serve.
Wow, Shilpa, thank you so much for that recap and being on the ground to, break this down for patients like me. And I'm wondering, how does research help patients advocate for themselves? Can you talk to us a little bit about that?
So the question really is, how does patient-centered research help advocate for patients? And the main point of patient-centered research is that it's relevant research. And what we mean by relevant research is we translate the everyday lived experience of patients. So, things like, how do patients living with these conditions with chronic pain do laundry, for example? Very simple questions. What kind of hopes do they have when they think about attending their grandson's wedding or a graduation in their family? And so those are the pieces of the puzzle that you can't see on blood work or imaging. And so what we're doing with patient-centered research is combining those pieces of information with clinical research, data from EHR, and then building a bigger picture, a more fuller picture of the person, not just the patient. And so when patients then come to their appointments and talk to their doctors, they're able to talk about how this disease affects them in everyday lives. And so that's how they can advocate for themselves.
And Shilpa, on the other end, how as a researcher do you advocate for patients?
So as a patient advocacy organization that has a lot of emphasis on patient-centered research, one of our commitments to the patient community and to the clinical community, and of course to the research community, is to help advance our understanding in rheumatic and musculoskeletal conditions. And one of the ways that we can do this is by bringing together different pieces of the puzzle, because this really is a jigsaw where we have to build and piece together different pieces of information, different kinds of data, anecdotal data, data that's coming from the everyday lived experience, and then of course clinical and EHR data. And when we combine them all together, we are really telling researchers and clinicians what matters to patients, to people who live with these diseases.
Thanks, Shilpa. I love that metaphor about the puzzle. It really is so important to just bring together the lived experiences and the data to really get a full picture and help patients stay more informed on their health. You know, I also wanted to ask you, what's one study that you're presenting on that you think can help patients advocate for themselves with their doctor or with their loved ones?
So I'll tell you that we use our patient registry, the PatientSpot platform, to collect information, to collect what we call patient-reported outcome data. These are pieces of information that come directly from the patient, and then doctors and clinicians partner with us so that they can share information that they're seeing in lab works and blood works and imaging in their encounters with patients. Then we combine all this information. And so instead of just one study, think of the PatientSpot registry as the study here that can be used for patients to advocate for themselves, to talk about how this condition really affects them, impacts them every day that they live with it, right? So from walking your dog to getting enough sleep, to feeling fatigued, then going to work, and then coming back, meeting with your family, making sure there's, food on the plate, doing your social activities that helps you maintain your mental health. Those are the things that PatientSpot can help you advocate, because many of these diseases are invisible. And so one important thing that patients need to advocate for themselves is for us to make these diseases visible. And the way we make them visible is by collecting information from patients, directly from patients, combining it with EHR data, with clinical data, and then packaging it in a way that can then be shared with loved ones so that the invisible becomes visible.
Well, thank you, Shilpa, for joining us on the Health Advocates, for all your work you do on behalf of patients, you and the entire GHLF team. We're really grateful for this research that's being done and that we're able to share it with the patient community.
Thank you, Zoe.
And thank you to everyone who joined us live from ACR to talk about the research. You can really feel the spirit here, and we hope this helps improve patient outcomes. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt, and thanks for tuning in to our special episode about ACR.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.